Hello, everybody. It's me. I'm a nutty professor. I'm here at the offices of the oral surgeon. Very fancy office. Very fancy light fixture thingy, and they've really spaced very nicely, like 3 chairs in the whole space there, social distance. So anyway, I'm here. It's 9 o'clock in the morning. I didn't have anything to eat or drink for the last 5 hours. Elfie woke us all up at 5 o'clock in the morning as usual, and me out. Wanted to go play with his sister, who, as usual, wanted nothing to do with either of her brothers. And she just went back into her room and wanted the door shut. They came, but then they came and they cuddled very nicely next to me, and the babies, and got up and got here on time. So here goes. I think I know how to use my bud thingies, stick them in, and I don't know about the hitting ones. I'm not going to do anything fancy like fast forward. I think I'm going to be listening to Leonard Cohen, which is, I don't know, my friend in the other province is a big fan, so she might find that funny. So anyway, but I'm just going to, I think it goes from one song to the other. I'm just going to put it on YouTube. So anyway, and then laughing gas, that I'm going to be, about an hour from now, I'm going to be 3 teeth less. Going to be three parts of my body are going to be missing, but small parts. Anyway, so we'll let you know how it goes. Bye for now. Hello, everybody. It's done. It was, as I said to him, and he's a very good surgeon. But as I said to him, it was better than expected, but still terrible. It's awful, And I've got pain now, but considering pulled out 3 teeth, use the nitrous oxide, the laughing gas, which I've had with my own dentist. And, breathe in through the mouth, all of that stuff. Problem was I couldn't get the friggin' Bluetooth thingy to work. Actually, I got the speakers to work, but I don't have, phone music on my phone. I hardly ever listen to music. So I don't have like a playlist or anything. So I tried to put on Leonard Cohen on YouTube. And I think I've done it once or twice before, and it goes from one video to the next. And I just wanted the audio, so I didn't have to hear all the breaking of a bone, and and I think I heard "Dance Me to the End of Love," and then it went to an infomercial. And then it was, and I'm hearing all the scraping and all that shit, and I went to an infomercial, and I couldn't change it. The phone was like in my pocket, and I had the oxygen thingy on, or the nitrous thingy, and it was monitoring my blood pressure and the thing on my finger, and I couldn't go, excuse me, can you somebody do something with my phone so I get some music? And apparently my teeth are in pretty bad shape, and that's because I don't go for cleanings, and I don't go for cleanings because this is awful. I'm phobic of this stuff. And then my blood pressure is really high, and he goes, "Do you monitor your blood pressure?" And I go, "No." He goes, "Have you ever?" I go, "No." Don't have a blood pressure machine thingy. I have my doctor at my doctor's office. They take it every time I go, every 3 months. I haven't been in 3 or 4 months now with all the pandemic and stuff. But every 3 or 4 months, I do go to see my doctor. I have a very good doctor. She knows about the addiction. She monitors that. And she also monitors my diabetes thing and the diabetes medication I'm on. But I did go once during the pandemic to see her, and then it was like the phone, visits or the Zoom visits or whatever. But last time I went, the blood pressure was it's usually normal. So I think it was just the stress here, And then but it felt like 10 to 15 minutes, and it was like he said it's been 45 minutes. He's prescribed me Percocets, and he goes, given your history of recreational drug use, he said, I don't think that Advil is going to cut it. So he prescribed me a Percocet. I had my contractor when I went to Niagara, the guy that worked for me, who was a junkie. He did everything, morphine and OxyContin and Percocets. And I think I had some pain once for something, and he goes, here, have a perk. Have a couple of perks. And I took a couple, and I think I took a half, and it didn't do much for me. But that I don't know, for some reason the opiate-based ones don't seem, And I told him last time I tried the Tylenol 3, my dentist gave it, and he said, it's not going to cut it now. I can feel the pain. I'm biting down on the gauze, and then you can see, and then he said there will be bleeding. And at one point, I said I can feel the pain, and he goes, I'm not even touching you. He goes, he said that's it's your anxiety, but he gave me more freezing. So this side is okay because he gave me extra freezing. This side I can already start feeling the pain. It was terrible. It was good because I could have been much, much worse. He's an excellent, excellent surgeon. I have no complaints whatsoever. And considering that I am phobic, it could have been much, much worse, but it was still horrible. I could hear the breaking up of the tooth, and he goes, "You're going to feel the pressure." He said, "You shouldn't feel pain. You should feel the pressure." I could feel the pressure, but I think I felt a bit of pain too. But he could be right. I think it could have been in there, my anxiety. But it could have been much, much worse. I think the freaking, he said, you can see in the mirror, it'll go into the gap. And I asked about possible implants, and he goes, your gums are rotten. He goes, if we put implants in, they're going to come out anyway. So I have to go back. And I asked him, I said, is this all because I didn't go for regular cleanings? And he goes, yes. So anyway, but it's done. Only $1,400, and it's done. And now, he kept asking me, are you feeling nauseous? Just a taste of this freaking the gauze in my mouth is tasting awful. He gave me, because this is for diabetics, and you'll need your protein, and he gave me apple juice. He said, take apple juice, but then you can't drink or eat or anything with the gauze in my mouth, And so I'm going to hold off on this until I get home. And first stop, I'm going to go get the prescription filled, Percocet and antibiotic. It was terrible, but I don't think it would have been much better with the sedative, and then somebody would have had to drive me now and make all the arrangements and all that. This is okay. This whole the laughing gas, I was okay with it. Yeah, like I said, it felt like 10-15 minutes, and I think once the sedative wore off, I'd be feeling the pain anyway. So it's not, so I'm kind of glad I went with that, but it was just, oh my God, and I do kind of understand why my dentist was saying, try to go for the sedative if you can find someone to drive you. But anyway, it's done. It's done, and it could have been much worse. And he's a very good surgeon. for someone like me, someone who's a bit of I do like my self-medications, as everyone knows, and I am kind of phobic of pain and of doctors and of dentists and of sound of cracking up teeth. So for me, to have got through those just on the laughing gas and to be able to drive myself and, and felt the minimal pain. And, as he's very, very good. But in spite of all of that, it's awful. And the freaking gauze in my mouth and the bleeding, and he goes, and he's explaining everything. Do this, half an hour that, 45 minutes this, and I'm sitting there thinking, why didn't my Leonard Cohen play? I'm a little bit, I'm still fixating on that. But I heard what he was saying, and I get it. And I got to go home, take the Percocet, and take the get the prescription filled at my own pharmacy. Get the Percocet, get the antibiotics, and then tomorrow I've got to do this antibiotic gargle thingy twice. And then he goes, eat ice cream, eat cold or room temperature. So I guess no soup, it has to be room temperature or cold and soft. And then after that, like mushy rice or protein shakes. Excuse me, Nutty Professor? Protein shakes? Those two don't go together, And my niece cousin was going, oh, you should drink bubble tea. And I'm like, Nutty Professor is not a bubble tea kind of person. But anyway, it's done! Freaking done, and I have no complaints about the surgeon. A really, really, really good surgeon. It's just the whole process and procedure, and there's a fact that getting it done and the having 3 teeth removed, and and then my gums are rotten and all of that shit, but no one to blame but myself, But then the cleanings are so awful. The cleanings are so awful, and I think that's actually the doctor going by now. But anyway, so that's what's been happening. Anyway, talk to you later. Bye for now. Hello, everybody. It's me, Nutty Professor. I'm home, and I stopped at the pharmacy, and I got the Percocets and the antibiotic mouthwash, which I think he said I'm supposed to take tomorrow, and antibiotics. And right next to the pharmacy is Raba. So rather than go find the Drug Mart and Repark and all of that stuff, I just got everything from the Raba. Less selection, but I got ice cream when they get, the doctor gave me this, the fruit punch, I was supposed to have, I think I was supposed to have it there or in the car, but, I got the gauze in my mouth and kept asking me, are you feeling nauseous? And I'm feeling nauseous, but because of the freaking gauze in my mouth, and I'm like, because you feel like throwing up. But apparently I was supposed to keep it in there for the next couple of days, except for when I'm eating. And, the pharmacist tries to explain something, but I really couldn't understand them. They're very, very, very strong accents. I kept saying, excuse me, and it, but the doctor explained well, but I was still, still freaked out over hearing my teeth being, pulled out, So now, but I'm home. That's the main thing. In just a second, I'm going to take this freaking gauze out of my mouth. Look who's here, and no, I got to be very careful with these people's teeth because I've heard that for I think Loki, one of my previous cats used to have some dental issues, but he passed away of kidney stuff before I had to actually have any surgery done. So I got to be very careful with these people. I don't want them to go through this kind of shit, But I think the vet checks every year, and I think this one is starting to have some gingivitis, But not going to be able to brush your teeth ever. Used to kind of do Loki's. Anyway, you know what? I'm kind of looking forward to getting this gauze out of my mouth, having some ice cream. I didn't ask him if I could brush my teeth. He's given instructions. He's got, so I'm going to read the instructions. But I'm home and it's done. And apparently my teeth are in pretty bad shape because I don't get them cleaned. But now I know why. It's awful. Anyway, I'm hoping the Percocet helps. For some reason, the opiate stuff doesn't really do much for me. The Tylenol 3 did absolutely nothing that my own dentist gave me. So anyway, but I managed with the laughing gas. Didn't need the sedative. Didn't need anyone to drive me, and I'm home with the kids. So I guess it's all okay. And there is pain starting, but it's going to be. I had 3 teeth pulled out, but and I'm pretty sure my own the dental surgeon guy said I can take Advil. I'm supposed to take Advil and Percocet when needed, up to 1 every 4 hours or 6 hours, something like that. All the instructions are written there. Anyway, first thing first. Shit. There's bits of friggin' look at this. That is a piece of my tooth. There are bits of broken tooth coming out of my mouth. I can feel the jagged edge next to where he removed the tooth, I think. I think I read somewhere in one of the instructions that you're going to feel the adjacent teeth maybe a little bit scraped. You're going to feel them. I better rinse out my mouth, I forgot to ask whether I can brush my teeth. Is that another piece of broken tooth? Oh my God. Anyway, bye for now. Okay, I drank some of the fruit punch he gave me, and he gave me one of these specially for diabetics, meal replacement vanilla. He doesn't realize that I drink a lot of Coca-Cola, not diet even. But I don't really follow the whole, But anyway, I do take my metformin regularly, and I'm going to have a little bit of ice cream because he did say ice cream, So I'm going to have some ice cream, and then I can take the meds, the antibiotic. Got to get started on that, and the Percocet. I kind of hope it works because I haven't had very good luck with. Oh, and I got some yogurt. I think yogurt should be good. So all kind of, I think all the little bits of tooth are out of my mouth. The kid said he just had his 3 teeth removed. Where's the brother? Where's the other one? Because I get there's the third one. There's Finn and Agita and Lcee and Daddy. I could feel the stitches in my mouth. And I could feel it when he was doing it. And he said, "I'm doing the stitches now." And apparently the sutures or whatever those things are called, they self-dissolve, so they don't have to actually be removed. What a pain in the whatever. So now I'm gonna have a little bit of yogurt and some ice cream, and then take the meds, and then I gotta put the damn gauzy thing back in. Made me want to vomit before. There wasn't a lot of blood on them, but and I think tomorrow, not today, but tomorrow I'm supposed to gargle with that antibiotic mouthwash. Anyway, bye for now. I think I'm going to now, I've got enough material. I'm going to edit and post, So this is the Nutty Professor having had dental surgery. 3 teeth removed, use of laughing gas, not sedative, so I was able to drive. All of that part worked out fine, And actually the extraction was okay too. I mean, I didn't really feel the pain. I mean, I kind of thought I did a couple of times, but, I really didn't. And, and the 45 minutes felt like 10 minutes. I couldn't hear music, and, and I heard a really awful infomercial for somebody, well, you're supposed to get rich quick, one of those get rich quick schemes, and I don't know how that came on my phone, but anyway, it's over for now. Sweetheart, it's yogurt. You're lactose intolerant. You can't come down. You're not supposed to be eating that stuff. It's closed. It's safe. Anyway, bye for now. I'm just so relieved to have it done and to be home with 3 children, Okay, bye for now. Well, I ate some ice cream. I had that meal substitute yogurty thing, supposedly for diabetics. I had yogurt, actual yogurt. And then I took the Percocet, which is really OxyContin. So I guess it's oxycodone. I guess they're the same thing. It says oxycodone on the container. And then I took an Advil, and I'm pretty sure the dentist said you're supposed to take 3 Advils a day, and also the Percocet as needed, or Oxy, whatever it is. And I asked the pharmacist, and I'm pretty sure he's confirmed that. But then I couldn't really understand what he was saying. So now, I took the Advil, I took the Oxy Percocet, whatever it was. I hope it kicks in soon. And then I had some trouble changing the gauze because I spit out the gauze before. And to get it into the right spot, and it wasn't really, I had to fold it up a few times, and I had to do it with 2 pieces of gauze on the right one. The right one, this side, is hurting more. Well, 2 teeth came out from there. So, and I think I had him put extra freezing on the other side because I said I could feel pain when he hadn't really done anything, but he put extra freezing, so I guess I'm not feeling the pain there for now. So, and then you're not supposed to drink with a straw. I read but the that apple juice thingy he gave me had the built-in straw thing, so I did use the straw. But they say you're not supposed to use. I read the instructions, and you're not supposed to use the straw because if you suck hard, it might pull out the stitches or something like that. But I don't think I sucked that hard. So, but anyway, I am feeling the pain. I'm just waiting for the oxy, perco, whatever to kick in, and I'm home with the kids, and I'm biting down on this awful gauze. You're supposed to keep it in, I think, the first couple of days, except when you're sleeping or eating. Maybe I'm going to sleep a lot. So I don't know. But, when I took that previous gauze out, there was the gauze I put in myself was quite a bit of blood on it. So I don't know. But I think they said that's normal. The other thing they say is that, it's not a good thing if your blood pressure is high, which mine was, It also says that if you after surgery, for a week, you're not supposed to do heavy lifting, or you're not supposed to sign legal papers. But that's if you get sedative. And but I didn't really have sedative. I just had the laughing gas, and I was able to drive myself back. So I don't think mine. I think I can sign legal papers if I need to, but I don't really need to. So anyway, so there we go. 3 teeth of the nutty professor have been removed, and so I guess it's a distraction. It's kind of, it is a rechanneling, not a good one, but it is a rechanneling, and I really hope these Percocet thingies kick in soon, because the pain is really starting to ramp up now. Anyway, bye for now. Maybe I'll try out the ear potty things here. It didn't work there. Maybe I'll try them here. Anyway, bye for now. Okay, both the babies are here. One went under the bed, so that must be Lcee. Lcee is the one who wakes everybody up in the mornings and likes to go under the bed. So that's my Lcee, that's my Finn, and that's my Agita. Slightly unfriendly Agita in her pink tent thingy. Anyway, we're all together, and Daddy's just going to, deal with the aftermath of extractions. As you can tell, I don't handle pain very well. My father was like that too after his major accident, because he'd never been sick. And after his accident, he was on all kinds of medication, and he was in really bad shape. But he doesn't handle pain well. I guess it's something else I've inherited from him. Anyway, bye for now from the 4 of us. I'm now going to edit and post. It's now about 8 o'clock, and I've been mostly sleeping. That seems to be the one effect of that, the Percocet thing. So and I took the one, and then I took the other one right after the 4 hours. This is 4 to 6 hours. And I've been taking the antibiotic, having yogurt and ice cream, and a little bit of cheese and a small half a bun. Babies are nicely settled in their room. They've been in the living room with me, and then they came here and ate. And I've had the door open. I've been napping here and there. And Agita has been mostly in her room, though she did come to the solarium for a bit, and she's had her own supper. So she's in here. But now I think I'm going to end up editing and posting. I kind of put it off, but I'm going to end up editing and posting the 2 parts, so to kind of catch people up on what's been happening. If, again, don't have to watch these. I'm doing them mostly for myself, but this is kind of part of the whole process. And this was a pretty major thing for me. This whole, it's been a rechanneling. It's been a bit of an ordeal, but, and I'm not putting the gauze in my mouth anymore. I did it until a little while ago, and I kept taking it out to eat, but it's kind of making me sick, and it's not bleeding right now. I think in between, maybe I'll put it in for another, hour or two. But having that thing in my mouth is just awful. But anyway, so that's where we are. I mean, the 3 teeth are removed. It's now 12 days, going on 13 days clear. But one really major thing is done. The teeth have been removed, and now go for a follow-up on Tuesday. So, and all is well with the kids and myself. And, I've been, as I said, It was a bit of my blood pressure was very high during it, and he was getting a bit worried. I think it was just the stress, and and then but then I haven't actually been to see my doctor in a while too, so that's maybe something I should work on. But anyway, so I guess so far so good, and the rechanneling project is still going on, and the next few days. I may go to see some cars. I think I need a little bit more stress reduction. Let's see how the math is, and what's happening, and so anyway, so far so good. I'm going to edit and post. So from the two twins, from Lcee and Finn. I'm not sure which is which now, but from Lcee, Finn. I think that's Lcee. Finn. Agita, camouflaged on her bed, with a little bit of her food remaining, but she ate most of the wet. And myself, the nutty professor who has had 3 teeth removed with laughing gas, not with the, sedative or anesthetic or anything like that. And the place is starting to, there's a little bit of rechanneling going on here, so that solarium is usable. Agita does use it from time to time. So far, so good, bye for now.